The idea for this particular CME, basically when we were planning, normally what we do is we have some of the other clinical topics which are put up and everything. But this time we wanted to do something different, and we eventually ended up thinking about postgraduate surgical training, and especially with our Alcon Fidelis being one of the main important things, because nowadays all postgraduate training is happening on Help Me See platform or the IC platform, and the PGs get a first-hand experience of doing surgery virtually, so that they can actually respect the actual normal human tissue when they are operating on the patient. So safety comes first when it comes to all these things. So surgery is not merely about acquiring technical knowledge or learning specific procedures. It's an art, a science, and above all, a lifelong journey of continuous learning, refinement, and dedication. As postgraduate surgical trainees, you are embarking on a transformative path that will not only develop your medical expertise, but also shape your character, discipline, and professional ethics. This period of training is intense, demanding, and at times overwhelming, but it lays the foundation for your future as a competent, responsible, and a compassionate surgeon. The very idea behind this CME was to establish the learning-based system on scientific guidelines that you can practically implement in your surgical training. Every talk today has been thoughtfully curated by our esteemed faculty members whose dedication and experience we deeply respect. Today, I would like to introduce you to the highly practical and holistic approach to becoming a better surgeon, the 10 commandments of surgery as shared by one of my gurus. And let us now explore these commandments one by one and understand their profound significance and surgical training practice. So, keen observation. So the first and the most important fundamental skill of a good surgeon is keen observation. You must develop the ability to closely observe not only the patient's condition but also the surgical field, detecting subtle signs that can make all the difference in critical decision making during the surgery. Observation sharpens clinical judgment and helps avoid complications. Motor skill development. Now, basically, surgery is more of a skill-based discipline. And beyond theoretical knowledge, a surgeon must cultivate fine motor skills, precise hand-eye coordination, steadiness, and controlled movements. These skills are developed through deliberate practice, repetition, feedback in simulation labs, wet labs, and supervised surgeries. For most ophthalmology PGs, I normally recommend them to strengthen their left hand, because as you keep learning surgery, you eventually realize how important the left hand is when it comes to the surgery. So people start brushing with their left hand, doing their normal day-to-day activity, start writing with the left hand. So there are quite a lot of deliberate things that you can actually start doing to strengthen your skills. Economy of movement and repeatability of steps. So repeatability is very important, and unnecessary movement at every stage inside the eye should be avoided. So each movement should be purposeful, rehearsed, and aimed at reducing fatigue and the operative time while ensuring safety. Mindfulness plays a very important role, and it involves being fully present and aware during the surgical procedure, and which helps in understanding the patient's status and anticipating what might come next. And this helps a lot in reduction of stress as well as maintaining a calm in decision making during the surgery. Visualization of the surgery. Now, this is one of the most important things. What people say is, even before you operate on a patient, you should actually operate in your mind. Before you even think about operating on the patient, you need to plan exactly what you are going to do on the table. So that is one of the most valuable lessons that we learn about visualization. And we need to plan the maneuvers in advance, mentally rehearse complex steps, especially in our case, suppose we have zonular instability, keeping a CTR on the standby, or anticipating any of these things. So visualization is very important. Coming to algorithm of the surgery. Now, when I say algorithm, each one of us has a particular step. So when you are doing teamwork, which comes next, algorithm plays a very important role. So for every surgery, we follow a particular pattern or a step, like how a computer program guides the algorithm, are guided by the algorithm. Every surgeon must develop their personal surgical algorithm and a step-by-step systematic approach to every case. This reduces the variability, improves reproducibility, and ensures no critical step is overlooked, regardless of the case complexity. Physical activity, exercise, and rest. These are very important, and they form an essential part of surgical training in maintaining physical fitness and mental well-being. Long hours in the OT demand stamina, strength, and focus. Regular exercise improves endurance and hand steadiness, while proper rest prevents burnout and sustains mental clarity. Teamwork. No surgeon works in isolation. Surgery is inherently a team effort involving nurses, anesthetists, technicians, and fellow surgeons. And effective communication and mutual respect and shared purpose are vital for smooth operation in the operation room dynamics and better patient outcomes. One of the most important things for postgraduates is performance review. So whatever you operate, record. That is what I keep telling students. Record whatever you're doing. So reflection is a powerful tool for growth, and after every surgery, practice reviewing your performance, have discussions, analyze what went well, what went wrong, what could be improved, and how to address errors or challenges. Feedback from mentors, video recordings, and self-assessment sessions help you grow professionally. And last but not the least, keeping yourself updated with the innovation. So whatever new technology comes, we need to make sure that we are constantly updated with the surgical instruments, devices, and the newer technologies that empower you. And never hesitate to learn and integrate the newer techniques and technologies, and never hesitate to learn from anyone. However senior you become, keep your ego aside. If you think that someone else is doing a better job than you, try to learn. Go talk to them, learn the newer steps, and make sure that you are giving something good back to the patient. So in conclusion, postgraduate surgical training is not just about accumulating knowledge or logging cases. It's about evolving into a thoughtful, skilled, and a compassionate surgeon. The 10 commandments of surgery offer a structured roadmap to sharpen your skills, maintain your well-being, and continually expand your capabilities. I encourage each one of you to embrace these principles wholeheartedly, learn from your mentors, practice with discipline, reflect clarity, and never lose your passion for patient care. The journey is challenging, but with the right mindset and approach, it is immensely rewarding. Thank you so much.